My name is Dr. Micah Hamilton with South OC Chiropractic. Millions of Americans suffer from back pain every single day. I'm going to go over the top 3 stretches you should be doing on a regular basis if you're suffering from back pain. So most of us are getting more sedentary as life goes on, because let's face it, most of our jobs require a lot of computer work. Then you add on the time you spend on the couch or the time you spend on your cell phone, and we're spending a good portion of our day sitting. That causes certain muscle groups to tighten up, specifically the hamstrings and the psoases. So the first thing a lot of times people think when they're stretching their hamstrings that they want to bend down and touch their toes. The problem with this position is that puts a lot of stress onto the lower disc, and many times if people have disc bulges, herniations, or sequestration, it can cause irritation in those areas. So instead of bending forward like this and compressing the disc, the best way to stretch your hamstring is to elevate the leg on something that's stable, slight bend in the knee, and what you'll want to do is push the chest out. Imagine like there's an imaginary wall there and you're trying to push the chest forward. As soon as you end up actually feeling that tension right there, you'll take a deep breath in, hold that breath for about 5 seconds, contract with 50% of your strength, pushing the heel actually down to the table. Relax after 5 seconds, push forward, maintaining that proper posture. This gets you a great hamstring stretch without causing that pressure onto the low back. Another muscle that many times people don't even know they have is called the iliopsoas. The iliopsoas, which is a hip flexor, attaches to the hip, but then comes up and attaches to every single lumbar disc and vertebra in your low back, and many times causes numerous different types of low back pain. The best way to stretch this is a nice lunge stretch, where you're going to take a long step out. You always want to make sure the knee is never over the toes there at that point in time. You're going to arch back like this, heels off of the ground, and you want to feel a nice stretch right here in the front. You're going to breathe deeply, deep breath in, breathe out, and kind of lunge forward into that. Once again, making sure the knee never goes over the toes so we reduce those shearing forces onto the knee. You'll take about 5 to 6 deep breaths and keep lunging into it lower and lower. For many of you, if you have weak legs, you'll want to be by something to make sure you can support yourself just in case there's any type of muscle discomfort or cramping that comes about with that. Then also there's disc pathology that we have to address. Sitting compresses the disc. The disc is 80% water. So with the disc being 80% water, we want to use what's called imbibition, or a pumping mechanism that helps to get nutrients back in that disc, allowing it to heal. One of the best ways to do this is actually through a cat-camel exercise. You'll be coming on all fours, and what you'll do is you'll kind of pretend like there's a string pulling through the belly button. You're going to sink the back down, and you're going to arch back up ever so slightly. Come back down, push through, arch back up ever so slightly like that. Doing about 2 sets of 15 to 20 repetitions will help to pump the disc, alleviate some of the pressure onto those regions, and reduce that back pain you've been suffering from. So try those 3 exercises out. Definitely make sure to consult your chiropractor to make sure that these are things that you should be doing on a regular basis to ensure you do not have back pain in the future. Because remember, when your body's out of whack, Dr. Hamilton's got your back.